you ever had congestion making it difficult to breathe? Imagine having this every day of your life. That is something that a person diagnosed with cystic fibrosis has to deal with every day. The purpose of this presentation is to inform you as my audience with a basic understanding of cystic fibrosis in 3 areas. 3 areas that are key to understanding this disease include causes, signs or symptoms, and treatment. So first, what are the causes? Well, first off, cystic fibrosis is a genetic disease, meaning the only way that a person can get it is if it is inherited from their parents. Next, the CF gene is mutated, meaning that it is not functioning the way it should be. It's defective. It doesn't work right. Next, each parent has one defective gene, which means you receive one defective gene from your mother and one from your father if you were diagnosed with the disease. And lastly, according to the Cystic Fibrosis Foundation, over 30,000 people in the United States currently have cystic fibrosis. So next, there are many common signs or symptoms of the disease. First, thick or sticky mucus in the respiratory system. So rather than the mucus being thin and being able to be coughed up like most people, if they have the disease, it is thick and it gets stuck in the lungs and it's difficult to get out of the lungs. So because of this, this can attract bacteria, which may cause a respiratory infection. Examples of these include pneumonia or bronchitis. This can also make breathing difficult, so there may be shortness of breath or wheezing. Next, a person with cystic fibrosis might have greasy stool with a foul odor. This is because there's also mucus in the digestive system. So when they eat food, the digestive enzymes aren't able to work correctly because there's mucus in the tubes that digest them. And so they aren't able to absorb the nutrients appropriately. This can lead to malnutrition or poor weight gain. Next, the skin may have a salty taste. So a person with cystic fibrosis excretes more salt than someone who does not have the disease, which means, and since it can't be absorbed by the body, it's actually released through the skin as sweat. So if a person with cystic fibrosis, if their skin were to be tasted, it would actually taste like salt. And lastly, according to the United States National Library of Medicine, 97% of men with cystic fibrosis are infertile, which means they cannot reproduce. This is because they have mucus actually plugging the tube, which allows sperm to be released from the body, or the tube is just non-existent itself. And lastly, although cystic fibrosis cannot be cured, treatment can control the signs or symptoms. Treatment may include chest physical therapy. The purpose of this is to loosen the mucus, and according to Mayo Clinic, it is usually done 1 to 4 times per day. One technique for chest physical therapy is to cup the hands and then clap the chest from either the front or the back tightly so that secretions are able to be released from the lungs so that they can be coughed out by the patient. Another technique includes breathing techniques. So an example of this would be deep breathing. Another treatment includes vest therapy. So the patient would actually be fitted for a vest which covers their entire torso, and then there is a tube that connects to a generator with air. And the air inflates and deflates the vest quickly so that it creates a vibrating effect, which also loosens the secretions within the lungs so that they can be coughed out by the person. In addition, respiratory medications can also be used as a treatment. Examples of these include mucolytics, which are just to loosen the mucus, or bronchodilators, another type of medication that just opens the airways to allow for easier breathing. And lastly, pancreatic enzymes should be given with all meals or snacks. Since the person is actually lacking pancreatic enzymes, these will replace those enzymes and will help absorb nutrients. In conclusion, in this presentation, I have informed you of 3 aspects of cystic fibrosis. 3 aspects of the disease included causes, signs or symptoms, and treatment. In the future, if you hear of a diagnosis of cystic fibrosis, you may now understand a little bit more about the disease and the things that the patient has to deal with on a daily basis.